State Health and Social Welfare, Dr. Tunji Alausa, is in Lagos for a three-day oversight function on how to better the health sector in Lagos and also meet the Lagos State Governor Sanwo-Olu. My name is Comfort Olayinka. Welcome to a cohort blog. We'll bring you more reports. The Minister of State for Health and Social Welfare, Dr. Tunji Alausa, was received with a warm welcome by the Director General Babatunde Salako and staff of the Nigerian Institute of Medical Research (NIMR). The Director General, on behalf of the staff and management of NIMR, decorated the minister. In a meeting with the minister, the DG, Dr. Salako, gave a rundown of the journey of NIMR for the past 10 years, their achievements, challenges, and expectations.
We are National HIV reference center for TB, for Borrelia, for HIV drug resistance, which is pre-qualified by the WHO. And then we had this mobile app that we developed with the current Minister of Digital Economy. He used to be, I think he's still one of our adjunct research staff. They developed the mobile app along with Dr. Amawodia, and they were tested for treatment of direct observed therapy, because some people may not want to be able to come to the hospital. So we did this so that this nurse can actually monitor how the drugs are being taken at home to remove the effect of stigmatization. We were working with Federal Ministry of Health, the malaria elimination program supported by a global fund. And last year, we discovered a new vector in Nigeria. Not completely new, but a vector hitherto not found in West African subregion. It's called Anopheles cifensa, which is an urban malaria transmitter vector. And we thought that this may be dotted around the country and may be one of the reasons why we've been having challenges in controlling malaria in Nigeria. One of the challenges that we have, number one, is that we don't have staff enough. I've just mentioned that all our outside stations, we don't have research staff, except one in two of the places, and they are just there. Then, of course, we are not able to perform the function of funding research, which is part of our providing an enabling environment for health research in Nigeria. So we believe that if we are able to get these two off the line, we will be able to do a lot more. Of course, there is issue of power. We are lucky we have a dedicated power line. We have 20 to 23 hours of light, but we have difficulty in paying because the bill is much. We are struggling to pay all the same. In 2020, when COVID came, government gave COVID fund to most institutions. And you can see the effect of that COVID funding on research. That is the proportion of the funding that we were given. Even though the proportion of the funding went up, the proportion for research was still very low. But the products and the outcome of research that are presented actually all came around the time when we had increase in funding. So when we noticed that we couldn't, the government cannot do everything and we are not getting enough, we decided to establish the NIMR Research Foundation, which is chaired by the former governor of Lagos State, Mr. Babatunde Lawal Salako, and with a few other people, including the 14th Emir of Kano, Mrs. Modima Kondiola, and two professors, one of our ex-wild DG. So these are the trustees of that foundation, because we want people to be able to put their money there, looking at the caliber of people that we have entrusted the fund to. So we thought that we should look for a long-term solution. And when NIMR was first created, it was first created as a medical research council. It was created as a West African Medical Research Council. After some time, it was changed to Nigerian Council for Medical Research, and then Nigerian Medical Research Council of Nigeria, before we eventually became National Research Institute. So we now thought that rather than ask government to create a new NMRC as a funding agency, NIMR can actually revert back to that, because that is how
To what? To national?
to Nigerian Medical Research Council. And this has been put into the House. The last assembly passed it, but I think it got to the president table when there are too many things on his table, and he couldn't attend to it. And after 30 days, it goes back to the House. It's gone back to the House. It was passed yesterday by the House of Representatives. It's going to go to Senate. And since it's a bill that has passed through there before and they passed it, they are very likely to pass it. So if they do, what it will require is presidential assent. And we will not be able to do that without the support of the Honorable Minister. So we feel that this is something you might want to look, do a deep dive to see how it will change the face of research in Nigeria.
The Honorable Minister of State for Health, Dr. Alausa, in his address says Nigeria has the leadership required to support research institutions to enhance our survival as a people.
We will do everything to support this agency. Professor Salako, you've listed a lot of things, and as you were talking, I think you're just talking to a converted choir already. I came from a country that research and innovation is everything. And the way things have been set up here, it's just been, things are fractionated. And there's too many silos. And if there are too many silos, with no communication, everybody will just be working in one direction. So several people are working in one direction and they're doing the same thing. That we will stop, and we've already started working on that. NIMR today should be the equivalence of National Institute of Health in America. It's very simple. And I share your pain and all this problem. Today, National Institute of Health in America has an annual funding of almost $600 billion. Government funding, protected funding. Republican and Democrat, nobody can touch that funding. If they touch it, they will lose. So some of the awareness we also have to do in this country is we have to bring the people behind us. Because if we don't, research and innovation is everything. So, and I'll tell you what we've done quickly. Yeah. And DG said, we have a national research committee. I looked at the members of the committee. A lot of professors, people that are accomplished. It's just on paper. And the first week I got in there, because I'm determined to resuscitate our research infrastructure in this country. Luckily, that was one of my main priority area. Luckily, that part, it's part of my schedule as the Honorable Minister of State. And I've also told the Minister Party that everything about research and innovation, I'll handle it. And we have full agreement on that, full agreement on that. Now, let me go back to the National Research Committee. Bright minds, professors, accomplished Nigerians. You set up that committee, not a naira funding behind it. How do you expect it to work? It's like you're trying to, a new child is being born, delivered, you put a coffin next to it. I said, it says that you put the next coffin and then you put the child there to die. That's just the analogy here. So I said, even if I were the most patriotic Nigerian now, I'm a professor, I've been honored to be a member of this committee. Oh, there's a meeting in Abuja. I'm retired. I'll buy my ticket, about 150,000 naira to get to Abuja. I'll stay 2 days in the hotel, another 100,000, I'll eat, and I'll get transportation to the ministry. By the time I'm done with that meeting that I went to do in Abuja, I would have spent about 500,000 naira. And I'm a retired professor. Where would I get that money? So that committee was being considered for almost 2 years, or how many years? Not a single meeting. So what we've done quickly is we've worked on putting budget, substantial budget to support the committee. We're building the secretariat, which I would request, and that's one of the things I want to talk to you at a meeting where we meet, but I'll tell you now. I'd like the secretariat of the National Research Committee to be here.
Dr. Alausa further emphasized the 4 priorities for the Ministry of Health under the leadership of the coordinating minister, Dr. Ali Pate, such as governance, unlocking the value chain of health sector, amongst others.
We came up with our broad 4 areas of priorities that the ministry will be working on in the next 4 years. The first is governance, improving governance in the healthcare sector. Governance in everything we do. The way we talk to each other, accountability, holding ourselves responsible and accountable to the people we serve in the country. The second priority area is improving our population health outcomes, which includes strengthening our healthcare system. And if we have to strengthen our healthcare system, we have to strengthen research. If we strengthen research, we would innovate. If any country does not innovate, that country will remain undeveloped. So research and innovation is a big part of what we're going to be doing in the next 4 years. The third priority area is unlocking our value chain in the healthcare sector. If we are talking about unlocking our value chain in the healthcare sector, we have to do research, we have to innovate, and then turn these research findings and innovation into value for money. We're talking about creating, building, expanding, actually just rebuilding or just starting a medical industrialization. Today, we're a country of 220 million people. We're not producing a single vaccine in the country. We don't have all the drugs that's been marketed, are being sold in the country, like NIPID, like national virus, that are populated with very smart Nigerians who want to work and innovate. But what we have now, what we lack now, is a leadership to support people like you. If we have to begin to unlock a value chain system to create jobs, hundreds of thousands of jobs to our young teeming population, our young people, men and women who have gone to colleges to study, but they're unemployed because the opportunities are not there for them. So we will work assiduously and very hard on that. The third part, the last priority area, is health. We need to start thinking health beyond physical security. It's social security and national security.
Dr. Alausa reiterated the need to prepare for pandemics as it is inevitable, expressed his determination to resuscitate research institutions in Nigeria.
We all knew what happened during COVID, and pandemic will come either we like it or not. We can just pray that it doesn't come again in a lifetime, but very likely it will come. But what do we do now? This is our honeymoon period. We have to prepare for the next pandemic. And if we have to prepare for that next pandemic and looking at health as national security, we need an institution like NIMR to function effectively the way it should be functioning. Now, these 4 priorities area align with Mr. President Bola Ahmed Tinubu, 8 priority areas. So we're in full alignment, and President Bola Ahmed Tinubu was very careful when he went and recruited myself and Professor Pate to head the health ministry.
Further indicated the need to source for funds as government cannot fund research alone, stating that research is key to survival of the nation.
As a stopgap, until we start to begin to get enough funding from the government. We will get funding from the government, but it's not going to be enough for what we want to do. Today, if we do everything right, we can mobilize $1 billion in research funding to Nigeria without problem a year. Because we have the population, we're about 230 million people. I need you to put a program in place how we can help reduce our current high rate of PMTCT. There has to be postdoctoral fellowship being done here. I need you to start that program where PhD students will finish, they will come and build expertise in what they want to do. Genetic biosequencing, drug and chemical analysis and things like that. So I need you to put a structure together for postdoctoral fellowship. The DG, Professor Salako, gave me a huge laundry list of what we could do, and I also gave him some of my asks. But a huge part of it is increasing our human resource for health. They have 2 or 3 regional centers that are not staffed, so I've asked the DG to put staffing plan together to help staff those regional centers and also add more research manpower to the main office here in Yaba. So we're doing that, improving the human research for health. They talked about funding. I've asked the DG to prepare a more robust budget together to support research. Research and innovation is a big plank of what we're going to be doing in this administration. Everybody's heard the President Bola Ahmed Tinubu, his emphasis on improving, revitalizing an healthcare system, and his commitment is unshaken. This is big to him. Look at what we have in Lagos State today. It was his own effort 23 years ago or 24 years ago, and that became sustainable to what we have today. And this is what this president wants to do for our country, the entire country of Nigeria. At the end of his administration, we will have a sustainable health care that delivers the best care to our people. The citizens are the center of our world. They need to get the best care, like any civilized society. I have to be honest with you, I was very impressed going around, listening to the DG and seeing what they have here. The equipment are state of the art, so that's not a problem. They're very well equipped. Now, how do we begin to use this equipment? I've just challenged DG, we need to build a postdoctoral fellowship on this campus. They have the facility to support it. So there's no reason why in the next 1 or 2 years we shouldn't have 200 to 300 postdoctoral fellowship here. People doing postdoctoral fellowship, and that would also help to meet our needs and our aspiration for the future of building an extensive research and base to support innovation that our country badly needs.
Government over the years may have been bogged down by other things on their table. Security issues of depressing economy and all of that. So they don't see research as priority. That's not to explain their action for them, but I thought that beyond those 2 reasons, if they understand the return on investment that have come from research, not just in terms of economic prosperity to the nation, but also the opportunity to develop homegrown research products that can solve our own problems rather than solutions that have been brought from elsewhere, which may not particularly address our own peculiar issues. So research funding is very important and critical to national development. You can extend it to many things. For example, here, we must have employed over 100 people under research funding. young people who ordinarily would have been roaming the streets. So funding research alone has an immediate advantage, which is creating employment for young school leavers. Not to talk of completing the research and finding research solutions to peculiar health problems. So it's a win-win whichever direction we look at it. And there is no nation that can develop without research and development. So we need to do a lot of evangelism, treated separately, because they innovate, they bring new solutions. They look at challenges, they find solutions to it. Not necessarily in the health arena alone. In all human endeavor, research is very useful. So government needs to realize this to ensure that even if there are general bans on employment, if research institutions, including the universities, because that's where a lot of research is being done, they need to be replaced for them to be able to maintain the capacity to do research and find solutions to our challenges.
Dr. Tunji Alausa, on his visit to Yaba Nephrology, Lagos State, says President Bola Ahmed Tinubu's vision is to improve Nigeria's health system that will help sustain every Nigerian citizen. During his address, he stressed the urgent need to reject the health sector with emphasis on expansion, while also assuring the Director General Dr. O.A. Owoye and staff of Yaba Nephrology Institute the ministry's unwavering support.
We talk about the things you're doing well and your challenges and how we can better support you as a ministry. But I want to get this information out to everyone, and it's in an unequivocal manner. We have a President Bola Ahmed Tinubu, that is determined to fix our healthcare system. So we have the commitment of the President. And that was why he appointed myself and Minister Pate to supervise the health ministry. And we're determined to give this country the best care that our citizens deserve. And part of this care, mental health, is a huge part of it. The medical director and the leadership, they're proactive. You have a 60-bed substance abuse unit now that is oversubscribed, and you are building another building at our meeting, we had suggested to the medical director that you can add some more additional floor to what you're building now, so that you can expand your substance abuse unit. Provision of funds for research and community education. This we will appreciate from you, sir. Provision of funds for the welfare of copper or indigent patients in the hospital. Currently, about 25% of patients in our hospitals, they don't have anybody to pay for their treatment, their feeding, their accommodation, their medication, and even when they die, we also bury them by ourselves. So we need support in this area. Provision of funds for the rehabilitation of old infrastructures in the hospital. Most of our wards are old, and we need renovation of such. We also need an improvement in the allocation on overhead to the hospital. Currently, what we are being given cannot even take care of our diesel and our electricity supply. Number 9, lack of infrastructure for the hospital involving medical services. On the 5th of this month, we started our own intensive care unit and medical services. It's at Oshodi Annex. So we use the isolation ward and the ICU. As I'm talking now, we have 5 patients in the intensive care unit here. So we are running the place. Honorable Minister, sir, there is also delayed final approval for waiver to recruit clinical staff. Most of our clinical staff, they are left. I keep on approving withdrawal of services almost every week. Currently, we don't have enough nurses, psychologists, doctors in the system. If we include the consultant psychiatrists, they are also leaving. So we need approval for put according waiver so as to be able
to really recruit them. My Honorable Minister, sir, I wish to assure you that I am committed to the uplifting of the standard of patient care to an enviable position in this hospital, as well as ensuring that the entire workforce is well motivated to put in their best in the provision of qualitative care service delivery to the teeming number of patients accessing our service. I am equally committed to the improvement in the revenue generation of the hospital without necessarily increasing arbitrarily the patient charges, but ensuring that all areas of financial leakages are locked in the system. This will be able to do with the automated of our payment system and the electronic medical record. I intend to also open more wards for the admission of more patients because a lot of patients are on queue now to cater for the increasing number of cases of mental illnesses in Nigeria. This will be done as soon as the situation with the hospital manpower improves. My appreciation, sir. Once again, on behalf of the management, the patients and staff of this hospital, I would like to appreciate our Honorable Minister of Health and everyone here present for coming. And I hope that by this visit here today, this hospital and indeed the patient and staff will benefit from your visit immensely. Thank you.
He admonished the management to take seriously human development, as the ministry's effort is in place to increase the number of doctors from 5,000 to 10,000 by the next academic year. While expressing assurance from the leadership of President Bola Ahmed Tinubu,
I've mandated him to put a plan together in the next 12 to 24 months to increase our production from to about 50 to 80,000 nurses annually. Your institution is also going to be part of that program. I know you have a robust school of post-basic nursing in psychiatry. We're repurposing all our school of post-basic nursing to also start offering general nursing. And the registrar is very, very in tune with this. It's actually putting the challenge to our specialist hospital to quickly add a school of general nursing to your post-basic nursing. And one of the things that we will do, I know this hospital is in a place where land has become a premium. There's no land. We've discussed the ideas of what we can do to help expand your capability to get some more building and infrastructure to you for the hospital use. This hospital is positioned to help reduce this impending problem we're going to have into the future by increasing the level of awareness, prevention, treatment, and rehabilitation of patients who have substance abuse issues. But what I've seen on the ground, I'm very impressed. But we would also have to help them expand the facility so that they can build more wards for expand their substance abuse capacity. Right now they have about 60 bed. So they should be able to double this. We've identified facility that they can use to double this. And also, human resource for health is a major crisis. We've also discussed how we can increase the number of nurses the hospital is producing. So that's the essence of the visit, to continue to find a way to support and expand the services of the hospital.
Dr. Tunji Alausa paid a courtesy visit to the Governor of Lagos State, Babatunde Lawal, to discuss how to improve the health facilities in the state.
What Mr. President Bola Ahmed Tinubu has given us the mandate to reshape, revitalize, and get Nigeria healthcare delivery system to where it should be, where our citizens will have comprehensive healthcare. Every citizen in Nigeria. Our maternal mortality rate is bad. We have one of the worst maternal mortality rates in the world. Our infant mortality rate is bad. Our under five mortality rate bad. Our stunting rate bad. Our zero dose immunization. We're being compared to countries like Afghanistan. Though there's a bright spot here, Lagos State has done reasonably well. That's one of the things I discussed with Mr. Governor, that, okay, you've done well, but how can we further assist and support the state to continue to do better? Because if we're able to get it well in Lagos State, we can begin to replicate this across the country. So that's the pivot of my visit to His Excellency today.
Governor Babajide Sanwo-Olu, who received warmly the Minister of State, Health and Social Welfare, Dr. Tunji Alausa, assured the Minister of the State's cooperation to protect the lives and every human in the state.
I want to say that our conversations with you has further confirmed, our preparedness and our level of collaboration with the federal government. We will want to assure you that we are willing and we are ready to collaborate to foster areas where we see your expertise that can help complement all of the things we are doing, so that at the end of it, there are people, who are the reasons why government feels the essence, feels the benefits, of all of the interventions that we'll do. A lot of steps, we've enumerated, that we're going to be working and taking. I want to assure you that Lagos State, is more than, ready and prepared, to come up with, all of the various steps that will ensure that health is not only accessible, it's affordable, and we will, be hoping that, some of the experiences you've picked here in Lagos, you can also use to springboard and help, spread, all of the health coverage that's needed, countrywide, but generally it's really just to thank you for coming, to say to you that we're watching you, because you're a son of, so you will not, you have to represent us well and well, and we will also be marking to ensure that, as an indigene, you are not localized, but you are representing the whole country. We believe that you will support, Mr. President, to do well as our Commander-in-Chief and our President, and you also will bring all of your years of expertise, to bear at ensuring that health coverage and health, infrastructure, and health access in the country, will be improved upon. So once again, welcome and wish you all the very best. Thank you.
In an interview with the press, the minister warns Nigerians against rumor, especially on the internet, claiming human papilloma vaccine is dangerous. The minister emphasized that HPV is 100% safe and prevents cancer.
HPV is human papilloma virus vaccination. As you all know, this was rolled out by able First Lady, Her Excellency, Distinguished Senator Oluremi Tinubu. HPV vaccine is 100% safe. And as I said at my briefing, please, let's take all this junk in the social media out. This is a vaccine that has been in existence for about 18 years now. Nigeria is late to coming to adopting this vaccine. This vaccine saves life. Today, we have 8,000 women dying from cervical cancer in Nigeria. This vaccine will prevent cervical cancer by 95%. It's a safe vaccine. We should encourage all our young girls between the ages of 9 and 15 years to get this vaccine. In fact, in other parts of the world, this vaccine, HPV vaccine, has been expanded to as far as high as 45 years old. It saves life. It prevents cancer. This is one of the preventive things we could do to help our healthcare system. So let me emphatically say again, HPV vaccine, human papilloma vaccine, is 100% safe. I'm a physician. I'm a father. I have a daughter. She got the vaccine when she was 13 years old. That was even about 13 years ago. So I'm putting my mouth where my money is. HPV vaccine is safe. Please discount any ignorant, uneducated social media information you get, this vaccine is safe. You can see what's happening in Lagos today. His Excellency has continued what Mr. President started about 24 years ago when he was governor of Lagos State. At that time, our healthcare system in Lagos was in shambles. He pieced it together. Today, we have a robust healthcare system in Lagos. But I've challenged His Excellency, the governor of Lagos State, Governor Sanwo-Olu, that we can do better in Lagos State. And there are things that we've discussed on how we can significantly improve some of the services. And we want to use Lagos as a role model, as a bookmark to be able to roll out other plans to support our other subnational governments.
The Day 1 oversight function has ended with visits to different facilities in Lagos State. Hopefully, this brings positive change to Nigerian health sector. Bye for now.